There is a question that anyone reading the first 9 volumes of this series will eventually ask, quietly, of themselves. Does this actually work? The framework is elegant, the biology is rigorous, the logic of the levees, the circadian clock, the mitochondrial machinery, the light protocols. All of it makes sense on the page, but what does it look like in a real person's life? In a real medical record? In a real before and after, measured in numbers a doctor can verify? That is what Volume 10 is for. It is called The Patient, and it is the most different volume in the entire series. Where the first 9 volumes are theory, this volume is narrative, 3 patients, 3 life stages, 3 medical records that begin with numbers most adults will recognize and end with the kind of numbers their physician will not believe. Let me introduce them. The first is Quantilus, 44 years old. He works in an open-plan office. He works under windows that filter out the light wavelengths his cells evolve to require. He sleeps 6 to 7 hours. His blood panel arrives on his phone one Tuesday morning with 5 flagged numbers: fasting glucose, triglycerides, HDL, C-reactive protein, vitamin D. The note from his physician says, "Let us talk about lifestyle." Quantilus is the patient most people watching this video already are. The functional adult whose biology is quietly drifting toward disease and whose physician has run out of vocabulary beyond standard recommendations. The second patient is Margaret, 65 years old. She walks into a dental chair after 4 years of avoiding the dentist. The hygienist measures pocket depths and bone loss that point to a system-wide bioenergetic failure unfolding for decades. Margaret has type 2 diabetes. She worked night shifts as a nurse for 11 years in her 30s. Those years are not in her record, they are in her cells. Margaret is the patient. Most people watching this video have a parent who is. The third patient is Ethan, 16 years old. He weighs 218 pounds. He has an ADHD diagnosis. At 2 in the morning, he is not asleep. He is playing a game whose reward architecture has been engineered to exploit his neurological profile. His melatonin onset has shifted to 2 in the morning. His suprachiasmatic nucleus has concluded that sunset has not occurred. Ethan is the patient. Most people watching this video have a child who could become. 3 patients, 3 completely different presentations. A conventional medical system would treat each of them with a different specialist: the endocrinologist, the periodontist, the psychiatrist. Volume 10 does something different. It walks all 3 through the same 5 superlevees that have been the architecture of this entire series. For each patient, the book asks, what input is missing? What therapy restores it? What is the predicted timeline? What measurements should change? And then it tells you what happened. Quantilus after 12 months. Fasting glucose, 101 to 94. Triglycerides, 168 to 128. C-reactive protein, 2.4 to 1.3. Vitamin D, 24 to 42. Heart rate variability, 23 to 38. The afternoon energy trough is gone. Margaret after 12 months. Hemoglobin A1C, 7.8 to 6.7. Bleeding gum sites, 14 to 0. Sleep apnea events, 22 to 4. Ethan after 12 months. Weight, 218 to 193. Bedtime, 2 a.m. to 10:30 p.m. Stimulant dose reduced. Anxiety conversation tabled. Grade point average up. The mother in the waiting room has a different question for the dentist than the one she came in with. These are not isolated success stories. They are predictable outcomes of a framework applied with discipline to 3 specific human biologies. The science behind the changes is the same science the previous 9 volumes built. What this volume adds is the proof of concept. The walked-through, measured, day-by-day demonstration that the theory translates into bodies. If you have wondered whether they would change anything, this is the volume that answers it. The Patient, Volume 10 of the Living Energy series by Hornbeak. Read the book.